This video will show you how to measure for and order a made-to-measure compression therapy garment from the industry's premier supplier, Gottfried Medical. To measure for a knee length, thigh length, or waist length product, you will need Form A13AY3, the Gottfried Medical paper tape labeled knee length or full length, a sanitized cloth or disposable measuring tape, and transparent tape. The measuring procedure for knee length, thigh length, and waist length supports is very similar. We'll start with knee length. Have the patient or customer lie face up with the leg slightly elevated and the foot at a 90-degree angle. On the knee length tape, find the 0 strap. Place the spine of the tape at the bend of the instep and wrap the 0 strap around the highest point of the heel. Fasten it securely with the adhesive pull tabs and reinforce with transparent tape. The placement of this first strap is critical to the placement of all other straps and ultimately to a correctly engineered support. Working toward the toes, continue to wrap the rest of the straps around the foot. Before securing each strap to the spine, run your finger around the foot to take up any slack. The strap should be perpendicular to the spine of the tape and parallel to each other. They should be snug, not loose on the skin, nor so tight as to cause the skin to bulge. The last 2 straps for the foot are placed at exact locations. The second to last strap goes around the ball of the foot, and the last strap goes at the base of the big toe, crossing over the little toe. These measurements ensure that the support stops at the base of the toes. If it's too short, it may ride up the foot. If the shape of the foot prevents correct placement of these 2 straps, then a closed toe support is recommended. To ensure correct placement, you may need to pleat the tape to shorten the distance between 2 straps. As you fold the tape, make sure to keep the spine in a straight line. Secure the pleat with transparent tape. Then continue measuring up the leg from the 0 strap. If you are measuring for a knee-length garment, the last strap should end approximately 1/2 inch below the bend of the knee. Again, pleating may be necessary for proper placement. If you are measuring for a thigh-length support, keep measuring up the thigh, wrapping the tapes in the same manner as the calf. The last strap should end within 2 inches of the groin. This helps prevent the support from sliding down the leg. If the patient or customer is heavy, gently pull the tape in until reaching a firm point. If the straps are too short to wrap completely around the leg, use a Gottfried Medical extension tape. A standard thigh-length support requires the use of a garter belt, so be sure to include a waist measurement on the order form. Other methods of holding the support in place include an optional silicone band or a soft-top cotton fabric used with water-soluble adhesive. Keep in mind that a silicone band tends to roll or curl on a heavy person. In such cases, we recommend using a roll-on adhesive. To remove the tape, cut the straps on the scalloped side of the tape spine, below the strap identification numbers. You can either enclose the tape with the order form or record the measurements directly on the form. Take the measurement from the straight edge of the tape. For example, the circumference of the heel at the 0 strap measures 11 3/8 inches. On the form are numbers that correspond to the straps on the tape. Record the measurement in the box above the 0. The bottom row for the left leg, the top row for the right. Wherever there is a pleat, measure the distance between the center lines of the 2 straps that are now closer together. Record it on the form between the numbers of the appropriate straps. For example, the pleat between straps 12 and 13.5 measures 5/8 inches. The last step is to measure the length of the foot. This is required for all lower extremity supports and garments. The preferred method is to have them stand with the foot on a blank sheet of paper while you trace it. This allows for the possibility of a foot deformity. If a foot glove is required for control of edema or hypertrophic scarring, you will need to trace the entire foot, outlining each toe to the web. Keep in mind that if you fax your order to us, the tracing may be distorted during transmission. To ensure accuracy, indicate the actual length of the tracing or provide 1-inch increments. As an alternative, have the patient or customer lie down and measure from the end of the heel to the tip of the longest toe. Then record the measurement on the order form. This completes the measuring procedure for knee length and thigh length supports. Measuring for a waist length support is similar to thigh length, except that it requires a few additional measurements. Start by measuring the leg as you would for a thigh length garment. However, instead of stopping 2 inches below the groin, extend the measurements as close to the groin as possible. Next, measure for girth and length using a sanitized cloth or disposable measuring tape. A diagram on the form shows where to position the tape. With the patient or customer standing barefoot, measure the waist, or point E. On the form, record this measurement in the table beside the diagram, next to the letter E. Then measure from point E to the floor, and record it in the corresponding space in the table. Follow the same procedure at points D and C. Measure girth and length at point F if the patient or customer is pregnant or has an abdomen measuring 50 inches or more, or if a support extending above the waist is desired. Next, measure and record the inseam from the floor to the groin. This measurement is needed to determine the leg length of the support. Measure and record points L and R, the girth at the top of each leg at the fold of the buttock. Finally, remember to include foot length. On the order form, be sure to indicate whether the patient or customer is male or female, whether the crotch style is to be open or closed, and their height and weight. This concludes the measuring procedure for a waist-length support. Measuring for a lower extremity stump support differs slightly from what we've described so far. Begin at the groin and measure toward the knee, taking circumference measurements as close as possible to the end of the stump. With paper straps securely fastened, measure the medial, lateral, posterior, and anterior length from the center of the last strap to the opposite side center line. Then measure the inside length from the groin to the end of the stump. The girth measurements should extend to within 1.5 inches of the stump end. Record the measurements in the appropriate boxes on the form, and be sure to indicate how the support is to be held in place. If selecting a chap style or garter, you will need to include a waist measurement. Remember, when measuring for a knee length, thigh length, or waist length support, start with the 0 strap at the instep. The second to last strap goes around the ball of the foot, and the last strap around the base of the toes. The knee length support ends 1/2 inch below the bend of the knee. The thigh length ends within 2 inches of the groin. For a waist length support, measure girth and length as specified on the order form. All 3 supports require foot length. For all compression therapy prescriptions, correct fit and pressure are absolutely critical. Only made-to-measure supports and garments can provide that kind of precision, and that's why healthcare professionals rely on Gottfried Medical. If you have a question or need assistance of any kind, our technical staff is just a toll-free call away and ready to assist you. Compression therapy is of great benefit in treating patients or customers with vascular or lymphatic conditions or scar-related injuries. Gottfried Medical made-to-measure products, with their superior fit and broad range of options, bring them a new level of comfort, convenience, and physiologically sound therapeutic effect.